Hi, welcome to BariNation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hi, friends. Welcome back to the BariNation podcast. One of our favorite guests is here, Dr. Chen. Hello, Fred.
Hey, guys. How you guys doing?
We are talking about a topic that we know is top of mind for almost every single bariatric patient. And we are thrilled to have now this definitive resource that you can refer back to if and when you experience hair loss. It's a thing. So today we're going to learn from Dr. Chen why it happens and what are the things that we can do to either slow that loss, mitigate it, and then help regrow hair when we are ready. So to give a little context to this conversation, I too, friends, I'm almost 6 years post-op. I have lost a lot of hair. And if you're watching YouTube, I'm not afraid to show this, right? Like I have very thin hair. Okay. But this is 10,000 times better than when I first underwent bariatric surgery and I started losing hair. And the things that Dr. Chen is going to tell us about today are the things that I myself have done and I'm seeing really positive results from. So, Dr. Chen, why do bariatric patients lose hair after surgery?
Well, I think this is a great topic, and thank you for making this happen. Hair loss can be part of the journey of our patients, and essentially, our bodies lose hair anytime they go through stress, right? And we all know that bariatric surgery, the metabolic changes that occur after a bariatric operation, cause stress on the body, right? We're in a calorically deficient state. The body is stressed out. It's losing weight. And all these things can, for some people, result in a little bit of hair loss or hair thinning.
I noticed it really a few weeks after surgery. And before my procedure, I had very long, thick, dark hair. And a couple of weeks afterwards, as I was washing my hair, we've seen this on social media, right? Kind of like clumps of hair were coming out. And I was a little bit panicked. I'm not necessarily a hair person, right? We all have things about our look and our bodies that we love. And we know a lot of people love their hair. They love styling it. It's a big part of who they are. So if that's you and you start losing hair, this is a really big deal. But the thing that I want to point out to you, and Dr. Chen said this before we started recording, if you're losing hair, it means that your body is kind of doing what it's supposed to do. You're losing weight. It's jettisoning the things that are not necessarily needed because it wants to dedicate and focus all of its time and energy to losing weight, to this metabolic change that's happening. So if you are losing hair, it can be a sign that you are losing weight, which is kind of the goal of metabolic surgery. And this doesn't happen to everybody, right? Some people don't lose any or a little. Some people lose a lot. What you do or how you prepare yourself for surgery and then how you stick to the guidelines after surgery can really mitigate this and help you regrow hair. So Dr. Chen, what are like the top 3 things that you see patients doing that are helping them mitigate and grow their hair again?
So I think one of the biggest things that we can do is that we recognize that hair too is a protein, right? So the biggest goal that we always focus on after surgery also helps with our, maintaining our hair growth. Protein. Yeah. We got to get the protein in. If we don't get the protein in, not only we're going to cause other issues in our bodies, but we don't get the protein in, we're probably going to have some more hair loss, right? So we got to get that protein in. If you're dealing particularly with some hair loss, upping your protein goals might help. So if you're typically a 60 to 70 gram protein per day, try to up it to 80 to 90. If you're 80 to 90, try to up it to the 100. More protein can help sustain our body. More protein can help with the hair growth. Then we also have to recognize that hair needs vitamins, right? And we always talk about vitamins after surgery. So a good vitamin regimen is really, really good for hair growth. We got to take our multivitamins, of course. And then there's a lot of hair, skin, and nail regimens out there, right? Those that have a lot of collagen, a lot of biotin, a lot of zinc. These, sort of micronutrients, microvitamins seem to be really, really good at promoting hair growth as well. And then finally, for people who are, despite all that, who are still having some hair loss, if they need to go on, another vitamin regimen, our recommendation really is for Nutrafol. from no financial, connection whatsoever, other than just seeing patients doing really, really well with it. Nutrafol is essentially like supercharged vitamins for your hair.
Mm-hmm.
And it results in, hopefully, as you can talk about, robust hair growth. And that hair growth sticks with you. It doesn't, you don't lose that hair as soon as you stop taking the Nutrafol. It sticks with you. And so Nutrafol would be our, other recommendation to help people grow their hair back. I wouldn't prophylactically start anybody on Nutrafol because anybody who's taken it knows that it's a bunch of pills. And so we want to sort of wait at least a couple months when we're tolerating things a little bit better before starting that. But it's definitely something to consider if we are running into that issue.
Yeah. My hair loss, like I said, started a couple of weeks after surgery, and I was not hitting a high protein goal. I had a difficult time kind of getting in my protein. And the vitamins that I was on at the time I didn't buy the chewable ones, which was by mistake, but I have rectified that. So I think it's important to know, get as much protein in as you can. And when you said that earlier, protein is hair, I honestly didn't know that. I thought it was something different. So to know that hitting that protein goal is so important for so many different reasons, I think can help motivate us in those first few months after surgery when it can be challenging to eat. You just don't feel like it. You're physically recovering. Your emotions are changing. Everything's all over the place. But if you can tune out the noise and just focus on protein, hydration, and vitamins, you're doing a great thing. And my hair did start to regrow once I kind of reached that low weight. And then I did try the Nutrafol products. I can attest my hair absolutely regrew. They are 4 pills and they are big ones. So you do have to be kind of prepared for that. But my hair has definitely rebounded, not to the point that it was before surgery. But the other thing that I think, especially for women, that we don't equate this with, but if you're entering into perimenopause, you're in menopause, or you're postmenopausal, you're naturally going to experience some hair loss with those hormonal changes in life. So when you couple that with bariatric surgery, it can feel a bit like a 1-2 punch. So just know, right, in the back of your mind, high protein diet, vitamins or vitamins specific to hair loss, and then onboarding that third kind of treatment is important. And I know, Dr. Chen, you recently came across a research study that said that exercise and movement could actually be something that helps our hair growth and our hair health. So what's the connection there?
So that was one other thing that we could talk about. So another good sort of foundation of post-bariatric care is movement, right? Or exercise. And so not only is movement or exercise good for our muscles, it's also good for our hair. Those studies have shown that muscle exercise can increase your blood flow. Increasing blood flow, including to your scalp, where all the hair follicles live. And so the hair follicles are now getting more oxygen, more blood flow. They're happier. And that results in, hair growth. So doing your exercises, that can also be linked to a positive and healthy, head of hair.
Yep. And we'll link that research study too in the show notes. So if you guys are curious to read more about that, just open up the show notes of this episode, either on YouTube or whatever platform you're listening to, and you'll be able to find them there. And I'll just offer too, from my lived patient experience, like I said, hair's not my thing, but it was a little bit scary when I could really see some big patches there. I really want to emphasize, try everything that you have at your disposal already before investing maybe more money in products like Nutrafol. They are expensive. And I think that a lot of times we can see huge improvements if we just really kind of get back to basics, really start tracking your protein, make sure that you're hitting that goal or upping it a little bit if you can. Vitamins, right? Focus on your vitamins. The other supplement, right, that Dr. Chen mentioned here was zinc. I never knew that was a vitamin that was really good for hair. So making sure that your multivitamin, right, has a zinc, or that if you choose to take a hair, skin, and nails formula vitamin, it also has zinc in it. And then there are movement, of course. I used to have long hair. I cut my hair short, right? I've been styling it a different way. When I go to bed at night, part of my nighttime routine is I take my hairbrush and I just massage my head with it. And I do that for a minute or two because I know that it's stimulating, right? It's telling my body, hey, something's going on up here and we want to spend some time and attention to it. So just, loving on yourself, loving on your hair, focusing on doing those bariatric basics can maybe really get you further than what you think you're going to do. I know it feels like we're bombarded with things to buy and try after bariatric surgery. It's just this constant, it's this shake and this bar and this pill and this vitamin, and it can be a lot. So I just want to take a moment and say, let's step back, take a deep breath, look at what we can do that's in our control before we explore onboarding other things, because it is kind of a natural process. You've gone through something major. Your body is stressed out, right? Because of the surgery, but give yourself some space and grace, right? Just give yourself some love, take a hot minute, look at what you're doing, and then move on from there.
Absolutely. Absolutely. So I think you touch upon a lot of important points. Hair loss can sometimes be part of the journey, but it is part of the journey. You won't go bald. You won't lose all of your hair. And like you said, that once we reach our lowest weight, typically the hair loss will stop and typically we'll start growing that hair back. So I know it sounds, if we're having hair loss, you can kind of take that as a sign that we're losing weight, which is a good sign. I know it's still emotional. So just, take solace in the fact that there's other people out there who are experiencing the same things. Take solace in the facts that if we keep to our foundations, we can minimize the amount of hair that we lose and that the hair will come back.
Yep. Absolutely. And friends, if you're looking for a place to kind of explore this, or you're worried about it and you just want to be able to share that concern with others and then talk to other patients who have seen positive hair growth right after their bariatric journey, join BariNation. That's the place that you can connect with other patients and you can keep learning from Dr. Chen. So once a month in BariNation, Dr. Chen leads a talk with a doc where you get to ask him questions and get his feedback. It's a wonderful, safe place to connect, learn, and grow with experts and others. So just head to barination.mn.co. You can also send us an email or a DM. If you're a patient of Dr. Chen's, you actually get a special membership rate because we are practice partners with Dr. Chen and Dr. Joe. So if you're interested in that, click the link in the show notes, send us an email to hello@barination.com or a DM on Instagram. Get a hold of us so we can connect you with the support that you need. Dr. Chen, thank you so much for this conversation today.
No, thank you guys. Thank you guys for everything you do for our community. Thank you for everything you do for our patients as well, who are members of your community. We absolutely, absolutely love you guys. You guys provide such an awesome resource, this being one of them, and all the other resources on the website. So thank you guys.
Well, we appreciate you too. All right, friends, we hope you enjoyed this episode and absolutely share it with somebody else that you know could be struggling with hair loss before or after bariatric surgery. This is a wonderful free resource that they can tap into, and we know they'll find a lot of value from it. All right, you guys. Thank you, Dr. Chen. We'll see you in the nation soon.
I'll
Bye.
See you guys soon.
That wraps up another empowering episode of the BariNation podcast. If you enjoyed today's episode, keep the conversation going by joining the BariNation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at barination.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at barinationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.